Okay, so once the surviving drug molecules have made it past the liver and into the bloodstream, it's time for phase 2, the grand tour. This is what we call distribution. And distribution is pretty much exactly what it sounds like. It's the drug traveling all around your circulatory system, hopping out of the blood vessels and spreading out into all the different tissues and organs to find its final target. Now, not all drug molecules travel alone. A lot of them are like little hitchhikers. They grab onto proteins in the blood, like albumin. And here's the key. Only the free, unbound drug can actually leave the bloodstream and do its job. And once again, being lipid-soluble or fat-loving is a huge deal here, especially if a drug needs to get past something like the blood-brain barrier. So to figure out how far a drug actually spreads, we use this idea called volume of distribution, or VD. Now, this isn't a real volume. You can't measure it with a beaker or anything. It's a hypothetical number that tells us something really important. Does the drug like to stay in the blood, or does it spread way out into the body's tissues? And here's why that theoretical number is so incredibly important in the real world. A drug with a low VD is pretty much all contained in the blood, but a drug with a high VD has left the blood and is now hiding out in the tissues. And that's critical, because if someone overdoses on a high VD drug, something like dialysis won't work. You just can't filter out a drug that isn't even in the blood to begin with.